Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by microbiologist. I hope all of you are well and fine. My name is Muhammad Kamil Khan and you guys watching my channel microbiologist. Dear friends, today I am going to explain another lecture that is related to the hormone test, and it is about the cortisol hormone test. Okay. So if you guys remember, we already talked different hormones, like we have talked testosterone, FSH, LH, thyroid hormones, okay, prolactin hormones. If you guys want to watch these videos lectures, so I will recommend to go back to my channel and watch this video lecture. There will be a playlist of the hormone test list. So when you click on it, so then you will find all the videos lecture related to the hormones. Now today I am going to explain cortisol's hormones test. So first of all, let's explain that what is actually cortisol hormones. Cortisol hormones is also called glucocorticoids, steroidal hormones. We also call it stress hormones because when there's a stress, so these hormones are secreted in a large amount. Next, that from where this hormone is secreted, mostly the cortisol hormones is secreted from adrenal gland, and when it will secreted from the adrenal gland, it will be secreted from the adrenal gland in response to ACTH, means when the ACTH hormone is secreted, so then the cortisol hormones is secreted. ACTH full form is adrenocorticotropic hormones. So it is another type of the hormones. Inshallah, I will also explain these hormones in some other videos lecture. Okay, so this is a short introduction to cortisol hormones. Now let's see the function of cortisol hormones. The first function of the cortisol hormones is that it can stop or it can prevent the inflammation process. Next, it can maintain the heart function. Next, it can maintain the blood pressure. Next, it regulates the fluid balance inside and outside. Moreover, it can also maintain the blood sugar level in the body. Moreover, it can also it can help in mental health. This hormone can also perform the function in to regulate the carbohydrate, fats, and proteins metabolism. Okay. Now these are the some of the most important function of the cortisol hormones. Now let's see the normal range of this hormone into the blood. Remember guys, whenever you want to perform the test of the cortisol hormones, so if let's suppose the doctor recommend the test between 6 a.m. to 10 a.m., so the normal range will be to 5 to 25 microgram per deciliter. This will be the normal range when the doctor recommend the test at 6 a.m. to 10 a.m. Let's suppose the doctor recommend the test of the cortisol hormone 6 p.m. to 11 p.m. Between this time, if the doctor recommend cortisol hormone, so the normal range will be 5 to 15 microgram per deciliter. Remember, at morning time, the hormone level of the cortisol will be a little bit high and it will be considered normally. But if during at night time, especially at 6 p.m. to 11 p.m., the hormone level will be low, means this cortisol hormone level will be low. Okay, so this is the normal range of the cortisol hormones. So now let's see that why the doctor recommend this test. What are the diagnostic purpose, or we can say diagnostic importance of this test? So mostly this test is performed to check out or to see the level of the cortisol hormone into the blood. As all of you better know that the cortisol hormone should be normal into the blood. It not too much high and too much low into the blood. Otherwise there will be the problems. I will explain it later. Next, this hormone test is also performed to just check the treatment efficacy. For example, if there is the problems arises due to the low and high cortisol hormones, and if you are providing some type of the treatment to control the level of the cortisol hormones, and if you want to check either the treatment is workable or no, so for that purpose the cortisol tests are also performed. Next, these tests are also performed to screen out the pituitary gland problems as well as adrenal gland problems. Means if you wanted to check either pituitary and adrenal gland are performing their function properly or not. So for that purpose, the doctor recommend cortisol hormones test. Next, this test is also used to screen out different types of the disease, like we have Addison disease, which is when the cortisol hormone are get low, so then it can cause Addison diseases. Okay, and this type of the test is also used to find out the Cushing syndrome. It means that the high level of the cortisol can cause Cushing syndrome. So these are the main purposes and diagnostic purpose, or why this test is performed, or why the doctor recommend this test. Now let's see the procedure. Now let's see the procedure of this test, that how to perform this test. Now whenever you want to perform this test, what will you do first? First of all, you have to take the blood, especially in the green top, or we can say heparin tube. So you have to take the blood in heparin tube. Once you take the blood in heparin tube, then what will you do? You will centrifuge it to separate the serum, or we can say plasma. Especially in this tube, we can get the plasma. After that, you will run this test on advanced machine, like we have Meglomi, Architect, Mendre. So these are the advanced fully automated machine. You can also perform that test on FIA based machine, means fluorescence amino assay based machine, like we have Digrade, Lofia, and Fine Care machine. So these are the semi-automated machine. So you can perform the test on this semi-automated machine as well. Now this is the procedure of the test. Now let's see that what are the main causes of high cortisol. When the cortisol level are get high, so what will be happen? Let me explain. When the cortisol level get high, so it is due to stress. Okay, so stress can increase the cortisol level high in the blood. Next we have Cushing syndrome. So Cushing syndrome is the disease in which the cortisol hormone get high. Next we have tumor in adrenal gland as well as in the pituitary gland. If there is the tumor in these two glands, so what will happen? Cortisol hormone will get high. Next we have corticosteroid medications. These are the types of the medication which are specially used to secrete the corticosteroid hormone, types of the steroid hormones. So when we are using these types of the medicine, so what will happen? Cortisol hormones will be secreted in a large amount. Next we have when a person get burns, so due to this way the cortisol hormones are also secreted. Due to eclampsia, and eclampsia is actually a birth complication disease, or we can say it is actually pregnancy complication disease. Next we have contraceptive pills. These are also a medication which are used to control the pregnancy, or to stop, or we can say to stop the birth, we can say like that. Next we have hyperthyroidism, when the thyroid glands secrete a large amount of hormones. Next we have obesity, when a person get fatty, so due to this way the cortisol hormones will be increased in the body. Let's see the main causes of low cortisol hormones. So when the cortisol hormones are get low, what are the main causes? So it is due to the stroke, or we can say the head injury. It is due to the Addison disease. It is due to the hypothyroidism, and we can say hypopituitarism. Hypothyroidism means when the thyroid gland secrete low level of the hormone, and when the pituitary gland secrete low level of the hormone, we call it hypopituitarism. Next we have adrenal hyperplasia. It is a type of disorder in the adrenal gland. Cirrhosis, especially liver cirrhosis. So due to this way the cortisol hormone will also get low in the body. Okay, dear viewers. So dear viewers, this is all about the cortisol blood test. Thank you so much for watching this video. I hope you understand, but if still you have questions, you can write it into comment. I will try my best to give you answer as soon as possible. If you like this video, make sure to hit the like button, share this video, and also subscribe the channel to get more interesting videos like that. Thank you so much.